Dr. Gene Elwing, it's a pleasure to be here with you at the University of Cincinnati. Thanks for having us. So we've talked about the rarity of portopulmonary hypertension and talked about the difficulty. Let's talk about treatments. Are there effective treatments for this disease?
Well, I would say yes, but we're lacking a little bit in terms of data. I'll tell you what we have and what we're going with at this point, but definitely an area for study. So I think we could start talking about just general measures we can implement for patients once we meet them. So in terms of pulmonary hypertension, we see a patient, we do an echo, we do the right heart cath, we diagnose them. We've diagnosed this individual, we're going to talk through, with portopulmonary hypertension. So general things we want to do, we'll start supplemental oxygen if they're low in their oxygen. We're going to start diuretics and manage their fluid status as best we can. We don't want these individuals to get dehydrated because we know that increases the risk of other complications of liver disease, including renal dysfunction. So we want to keep them euvolemic. There are some special things that this population specifically we have to be aware of. These are individuals we do not anticoagulate. We know they're PAH, and we know that in the past, we would anticoagulate people with WHO group 1 PAH, but these individuals have higher risk of bleeding. They have low platelets and coagulopathy, and they're not a group that it's indicated to use anticoagulation in. The other thing that we're mindful of is many of these patients come to us with known portal hypertension on beta blocker therapy for their portal hypertension, and we oftentimes work closely with our hepatology colleagues to take them off beta blockers. And that is based on a withdrawal trial that showed us that beta blocker withdrawal was associated with improvement in hemodynamics and exercise tolerance in these individuals. So some important caveats in this subpopulation. We try to avoid calcium channel blockers because we think that may be harmful in terms of their portal hypertension. And one thing we advise against is we advise against doing TIPS, or the procedure which we oftentimes do in patients with significant portal hypertension because that could exacerbate the heart failure. So special circumstances in this subpopulation we need to be aware of. No TIPS, avoid beta blockers, try to keep people euvolemic, and be aware that these are individuals that may need more aggressive therapy because they could be transplant candidates. So let's talk about the actual targeted therapies. We have limited data, but we have enough that can guide us towards the right direction, okay? In general, these patients have been excluded from clinical trials, so that's why we have the limitation in our information. But we oftentimes do extrapolate what we know from PAH patients and apply it to these individuals with good outcomes, improved hemodynamics and decreased PVR. So what little data we have is in the realm of endothelin receptor antagonists. So the first drug that was studied was Bothsentan. Small study, 11 patients with portopulmonary hypertension, and I'll have you look at this slide here by Hoper, and this was published in 2005 when Bothsentan was one of our only oral drugs available. They used this medication in these 11 patients, and they found that individuals at 1 year had significant reduction in their PVR. And patients tolerated the medication well without significant liver dysfunction. We know that Bothsentan has been associated with liver dysfunction in a fraction of patients, but it was not more common in these patients with liver disease. So very important findings. Another study I'd like to mention, and I'd like you to direct you to this slide, is a study using Bothsentan for a longer period of time. And these individuals were having a more advanced liver disease in a small fraction. And they tolerated the drug well, and they had improvement in their cardiac index, PVR, and walk distance. So encouraging data, but again, small group of patients and in a drug that's a little bit unnerving to use because of its known liver toxicity. So have we made progress since that time? We have. So I want to direct you to this slide on the Portico study. This was a recently completed study, and we were a participant in this study, and they looked at using macitentan, one of the newer generation endothelin antagonists, and using that in patients with portopulmonary hypertension. And they used that versus placebo, and they found significant reduction in PVR in that subgroup also, well-tolerated medication with about 35% reduction in the PVR. So this has not been formally published, but has been presented in abstract form and at national meetings in lecture format. So very, very exciting things to come, I think.
Signs we're going in the right direction.
Absolutely, absolutely.